Okay. Okay, we're going to call the December 13th Human Services Committee meeting together. And we do not have a quorum, so we can discuss what's on the agenda, but we cannot vote on anything. We will have to pass that on to audit and control. So at the moment, we do not have quorum, so we don't approve the minutes. Is there anybody to speak to privilege of the floor? No one to speak to privilege of the floor. We will move to our first proposed resolution, simply to discuss. Hello, Mr. Feldman.
James Feldman from the County Executive's Office. We have a couple board appointment resolutions and reappointment resolutions. So the first one is for the Community Service Board. It is to reappoint Marie Karuba to another term that would expire on 12/31/27, and she has confirmed that she would like to serve another term. She is the board's longest serving member right now, so they want to keep her on there to have some of that institutional knowledge.
Absolutely.
If you want, we can just move through.
Just move through.
Yep.
Unless,
Nope,
just
I'm good.
jump in.
So the second one, confirm appointment and reappointments to the Chautauqua County Youth Board. So for this one, we have one new appointment, Catherine Freeman. She is a school social worker in the Faulkner School District, and she came recommended from the Youth Bureau over in the Department of Social Services. And she has indicated she wants to serve on the board. And then we had 4 reappointments, Sue Drago, Nicole Roma, Dr. Ray Rushbolt, and Leah Chase. All of them have confirmed that they would like to serve another term, and those terms would be until 12/31/26.
Okay.
The next one is for proposed resolution, confirm appointments and reappointments to the Chautauqua County Office for Aging Advisory Council. Again, all of the reappointments and appointments have confirmed that they would like to serve on the board. We have 2 new appointments, Sarah Goebel and Laverne Terrell. Sarah is a retired clinical social worker, and Laverne has spent like 57 years in our local fire departments and was also a fire police officer. And both have already been involved with the board, so this would be to formally appoint them to their first term ending on 12/31/25, and that would be the same ending date for the reappointments: Ann Sullivan, Ellen Cafaro, Dr. Layla Denoya, Dr. John Hamels, and Dr. Lynn Bayless.
Okay.
And the final one, confirm reappointments, Chautauqua County Board of Health. We have 2 reappointments up this year. Their appointments would go until 12/31/29, and that is for Dr. Tariq Khan and Mark Tarbrake.
Very good.
Good.
No questions?
Thank you.
Thank you. That takes us to number 5 on the agenda, the proposed resolution to amend the 2023 budget to implement the morgue project using funding from the American Rescue Plan Act, ARPA. All right.
Dr. Mike Falk, County's Chief Medical Officer and Interim Public Health Director.
Sam Zaffoto, Fiscal Supervisor, Department of Finance, assigned to Public Health.
So recently, the ARPA Committee has tentatively approved ARPA funds to be applied to a county morgue, specifically a mobile type of unit. Why this has come about and why this is important, at least over the last several years that I've been involved in the coroner program, we have run into some real issues and some potential issues. Number one, there's just an overall lack of morgue space within Chautauqua County. Typically, the morgues would be at the hospitals. Over the years, that morgue space has diminished, and not only that, but they have their own uses for their morgue space. The hospitals have been recently very hesitant to allow us to transport decedents to their morgue, partly because at times the decedents are what we call unclaimed, so we can't find family, and therefore a nursing home may not, want to kind of get things initiated right away until we kind of get things finalized. We also have more and more situations where decedents or families do not have the ability to pay for funeral services. We're finding this in more and more frequency. So it is necessitating a little extra time to kind of get these things prepared for the funeral home. We've had at least several cases in the last couple of years of decedents that were sort of in advanced stages of decomposition. We had one incident this past year at a local hospital where the odor created a very difficult situation, where the odors were permeating into other areas of the hospital. And this also is the case for funeral homes too. Funeral homes oftentimes and unclaimed bodies can't get things started, whether it be cremation or embalming, until they know exactly what, who's going to pay, what's happening, or find family that can help make decisions. So as you can imagine, that has created some real issues for the local hospitals. So that's one example. The other issues were, last year, for example, we had the big blizzard up in Buffalo. The Erie County Medical Examiner's Office we can't take any more cases. We are loaded to capacity with deceased individuals. We had a mass fatality event during the blizzard, and we were required to, take care of our own here within the county during that period of time. And we ended up figuring things out. There was sometimes a day or two delay to get them up there during that time. But we really struggled with finding storage space. The other mission is, and this is, I don't even like talking about this, but, in the world that we live in, I think we have to, that we know that there's increasing violence and increasing numbers of mass fatality type of incidents, whether it be the violence or whether it be natural disaster. We have to be prepared for a mass fatality type of event. There are federal assets that can be deployed during a federally declared disaster, but most of those mass fatality events, you don't have a federally declared disaster. You think of what happened out in Hawaii with the fires. That was declared they did put federal assets there, and that included a disaster mortician type of team, a DMORT team. But those would be very few and far between unless we had a federally declared disaster. So there's a few options, and if you flip to kind of maybe the second or third page, we thought about a morgue that would be, just stationary, maybe housed within a public facility somewhere, or a container type of semi-permanent cooling unit, which could be moved but not readily, or a fully portable trailer type of unit. The latter probably makes the most sense because it can be deployed anywhere. It can be deployed to a scene. And I think that, we have somewhat of a responsibility to be good neighbors in the event that a neighboring county had a mass fatality event. This unit could be deployed to assist in those type of situations. During COVID, our county COVID team, we dealt with this issue, right? We were planning for these types of things. We said, what's going to happen if we have more decedents than we have space for? And, we talked about portable units. And thankfully, we never got to that point within the county. But I think we have to be prepared. So, you know, what we are asking for is a designation of $100,000, I believe it is. I think that based on some recent pricing that we have, I think we'll be able to do better than that. My hope is. So that's kind of the rationale of where we're coming from. So real local problems, but also from an emergency preparedness standpoint.
So you're proposing the pull-behind trailer, the 71,000?
That's what that's I think what we're leaning towards at this point in time. Yeah,
And
I
these
think that
funds
makes
are-
the most sense.
These funds are simply to purchase one of these,
Right,
probably one of these three options.
right. Yeah.
Do the funeral homes have like morgue facilities?
Only 2 of the funeral homes have cooler space within the county. I believe Lynn Funeral Home does, and then there's a North County funeral home that also does. But for all the same reasons, they're oftentimes, they have come through and helped us in times where we needed them to. But with some of these, sort of unique situations where there's advanced decomposition, it really creates some problems for them.
I just wondered if there was rental space. I didn't know if all of them, I had no idea. So thank
Yeah.
you.
Does a body decompose? I mean, in a cooler,
Yeah, I mean, it definitely helps stop the process. But
stop it or slow it?
well, I guess it all depends on how cold it is, but
Yeah.
it should at least temporarily really limit the amount of decomposition. I mean, it should, in essence, if it's cool enough, which it should be, it'll stop the decomposition process. The problem is that, oftentimes we're discovering, or somebody's discovering these decedents in 2 to 3 or 4 days of advanced decomposition. And that's where we run into the troubles,
So the incident at the hospital, they didn't have a cooler?
They had a cold storage facility within their hospital. It isn't necessarily contained. It's my understanding it's a very cold room, basically. But the odors permeated throughout
So the body's
into the
still
emergency
decomposed.
department, into the surgical areas, and it's just not, I mean, and they and unfortunately that individual decedent was there for several days. And if we had our own unit, we would be able to utilize that in one of our own county facilities and be separate from funeral home, separate from hospital, and just a more dignified, I think, approach to it.
Sure. Are any of one of these three a better option as far as being colder, I guess?
No,
for
I
lack
think
of a
they're all
better-
equal. There are
I mean-
different brands out there, but yeah,
Yeah.
as far as that's concerned, I think they're all equal
So
from
they-
that perspective. Yeah,
Perform the same,
yeah,
I guess.
yeah. There's the advantage of what we discussed is the advantage of the portable unit is that it can be deployed to a
Right.
scene or can be deployed to an adjacent county in the event of a mass fatality type of event. So.
You referenced in here that we would need to secure exterior space. So you're talking like maybe a fenced-in area, and would that add to the cost?
Yeah, so basically, we are in a situation, I think, multiple departments where we're really struggling with storage space for county assets. I think that's a bigger discussion that has been kind of ongoing. We would, at least temporarily, there's no reason why a portable trailer could not be stored outside. But when it is in use, we would put it inside. I've had discussions with the Director of Emergency Services. We have space there that an asset can be taken out of a garage and the unit can be pulled in for securities purposes. Yeah.
Yeah, that was my next question.
Yeah.
If there's bodies in this,
Yeah, and
It
it
has
won't
to
be a
be
regular,
secured.
it's not gonna be an everyday type of thing, honestly.
No.
It was one of those events that's an uncommon event, but it happens at least several times a year, and you really kind of need that space immediately. But then from an emergency preparedness standpoint, we gotta be prepared for these events too, so.
If you were to deploy this outside of Chautauqua County, would there be like a usage fee associated with it, or is it just we're just going to be good neighbors?
Yeah, I mean, I don't know that there definitely have to be a formal kind of, MOU in place. whether or not we contracted with a county which probably could make sense. We just don't know exactly what those expenses would be. But we'd probably want to recoup. But I think if you're thinking about a horrible event
Right.
like that, I think I'm just gonna go and
Right.
ask later. If we're asked for help, I think we just offer the help.
And I agree with you. I think
Yeah.
it should just be neighborly, but
Yeah.
I just wondered.
We don't want to, I don't want to necessarily place an unrealistic sort of fee structure there, because, there may be municipalities that would not want to participate perhaps, but we're going to do whatever we can to help if it came to that, so.
Okay. Anything
All I
else?
have. Nope.
All right, thank you.
All right.
Thank you.
Okay, number 6, the proposed resolution is to amend the Chautauqua County Department of Public Health 2023 budget for increased education for handicapped children administrative costs.
Yep, good afternoon. This resolution is just moving some money from the vacancy savings in public health administration to cover the overages in the preschool program. This program, basically, this is payroll allocations from elsewhere in the health department. With the change in the fiscal unit this year, different employees than what was planned during the 2023 budget were charged to it. We've gone over, but we do have the savings in the public health, both in benefits and employee services, to cover any overages in this department.
Good.
So it's budget neutral.
Budget neutral.
It's, vacancies in one is paying for the other. So.
That's correct.
Okay. Any reason for the overages?
It was just a change in the staff, with the Director of Admin Services retiring earlier this year and some other changes with the personnel in the fiscal unit of the former Health and Human Service. That's the reason. There was an extra employee's time included to keep up with this program based on those changes.
Okay. All right.
Good.
Okay. Number 7, proposed resolution to authorize revised lease agreement with Warwick Plaza LLC.
Good evening. I'm Greg with the Chautauqua County Veteran Service Agency. In the summer of 2021, we moved locations from our 610 West 3rd Street to 567 Fairmount Avenue. Our office is currently located on the 2nd floor. When we initially assessed the office space, we thought the handicap accessibility was suitable in checking it out, but in actual application, it's not ideal. The office on the 1st floor of the building opened up, and the county executive recommended we take a look at that because everything is entry level. They have big double doors for access for disabled veterans, and also in doing that to co-locate 2 of our department offices that are not co-located, put them together. So the PFC Dwyer grant, which is overseen by the Chautauqua County Veteran Service Agency, has an office in a separate location. So the resolution is to amend our current lease, so it's going to be the same term as far as length of time. The increased cost is going to be budget neutral because what extra we're paying, we're making up in combining with the PFC Dwyer program. We're also giving office space back to the Department of Public Works because that's currently where her office is. So it's kind of a good deal for everyone. And that's pretty much the gist of it, if there's any specific questions.
So is this the first, you'll be just taking over the 1st floor and keeping the 2nd floor?
No, so the 2nd floor will go back. So we're going to amend the lease.
Okay.
The 2nd floor will go back to they'll lease it out to someone else. We're just taking over the office on the 1st floor, and the 2nd one will be open for him to rent out as he sees fit.
So the 1st floor is bigger than the 2nd floor?
It's
Where-
bigger.
where
It's
you
a
can
bigger space in everything. If you were
Newly
to,
renovated.
yeah,
It's
if
a
you,
nice space.
yeah, if you actually go to the Warwick Plaza, you park up front, and I mean everything is. There's not
Sure,
even a
I mean,
stoop. Yeah.
Absolutely.
And there's double doors, a lot better for walk-ins, a lot better for wheelchairs, and then also to have our PFC Dwyer program coordinator there, and also a big space for PFC Dwyer events in the same building is definitely helpful.
It's a nice building,
Yeah.
newly remodeled.
Yes, yep.
It's very nice.
So there's an increase, but.
So the increase in rent is being offset because we are bring in another office to our office. So we're actually going to split it up where exactly what we were budgeted to spend as a Chautauqua County Veteran Service Agency for our office space for 2024 is going to remain the same. The difference will be made up by the PFC Dwyer program, and we've already looked at the grant money and made adjustments in certain places to make sure that everything balances out in the end. So there will be some administrative changes, but no actual changes in the amount of money we're spending.
Sounds like a great win-win situation.
Yep.
So,
I'm good.
thank you.
Is that it? All right. Thanks, guys. Have a good night.
You too. Thank you. Number 8, proposed resolution to authorize renewal of lease agreement for 2024 with City of Jamestown for office space for the Department of Mental Hygiene. Hello.
Well, I'm Trish McLennan, Deputy Director with the Department of Mental Hygiene and Social Services.
Okay.
And this resolution, we are currently in Jamestown, that site, City Hall, and it's just time for our renewal. We are, as you've heard before, really trying to work with the city on getting some renovations done, getting some necessary things fixed that we've been cited on by the state, ceiling tiles, that type of thing. But in the meantime, we do need a space. It is a large space because we do have a lot of therapists there. We do have providers, nurses, group space. So we've unable so far to find another suitable space. So we are continuing to do this, and I believe, I don't have it in front of me, but I believe we're going on a shorter lease. Is it 3 months at a time, 6 months at a time?
Says you're seeking to extend the lease for a period of 12 months.
Okay.
Beginning January 1, 2024.
Instead of doing a 3-year, in 12 months, even if we were to find a site, it would be obviously way over 12 months before we could get anywhere else.
Sure.
So typically, we would ask for a 3-year lease instead of 1-year lease, and continuing to work with the city of Jamestown to help make the repairs. Roof leaks, that type of thing. That's just hard in that building. So we are continuing to work on that. Carmelo Hernandez continues to meet with the city and request those repairs.
And we've been cited by the state?
We've been cited by the New York State Office of Mental Health in surveys. So they come and survey us every 3 years, and we have received citations. I helped facilitate the last one, and that is for ceiling tiles. Anytime there's a stained ceiling tile, the assumption, if you're in New York State, either Joint Commission or Department of Health or Office of Mental Health, is that it could be mold. We have had that checked, though, for the safety of our clients, and there have been no findings of mold, but that is still a citation to have things like stained ceiling tiles. So those have been repaired, but then there's a roof leak, and so they have stated they will fix it. We're now back into winter, so I know they won't be able to fix it until earliest the spring.
How long has this been?
That's what I was going to ask.
I'm sorry.
No, you're good.
Years.
Years. Okay, great.
It's that tough spot of trying to, our Dunkirk clinic, as you know, and you approved that, we were able to move
Right.
much smaller group. So it was much easier to find a space, get it remodeled, and get those folks in there.
How many square feet do you have?
9,100?
There you go, 91,
9103.
9100.
And
Yeah.
and is that what you would need going forward?
We would. I mean, it's a good and a bad problem to have. I mean, the good news is people are seeking our services. Bad news is people need our services. But yes, because you are talking group space too. Licensure requires that you have a minimum of 70 square foot for a office if you're going to be seeing patients. So those kind of requirements are there. But the good news is, and I was here last month and talking about this, we are trying to get more folks off-site for the right reasons, into schools. We're in 2 pediatrician offices. So we're continuing to try to manage the space appropriately and make sure that we still care for the clients. So I'm not concerned that we're providing poor care.
Right.
We just need, you would expect it, and I guess I'll say it this way. If you went to your family physician office, you would not expect stained ceiling tiles. You should expect the same care from your mental health professionals.
Well, yeah.
So that I will say.
You need a pleasant environment.
Thank you. You do, especially for that need, right?
For that need, yeah.
You are
it would-
correct.
Yeah. The rate at $14.60 per square foot is what the 2023 budget is, and it says we're at an increased rate approved by the county executive.
Yes, correct.
So-
It has gone up, just like everything else. So
Right.
yes.
Do we know the new increased rate? I don't Or
I
am
do not
missing
have it in
that?
front of me, but I can certainly
Okay.
get it for you.
All right, well, audit and control will need that.
It is. I mean, that's a
Is that the
tough spot.
only issue? The
That-
leaking ceiling? Or it seems like there's more
Yes,
issues.
yeah, I mean, it's mainly things like that. It's things that can be fixed, things that can be repaired, but it is an old building, and it just has not gotten the priority that it could get. You know, we've also, and, you know, you've read the paper, you've seen some of this. We have been working on safety for the parking deck. There have been some improvements for that. So our staff safety and making sure that the parking is satisfactory, that type of thing. That's not about that building, but that's just about that location.
So you're looking for something in the downtown Jamestown
Yeah,
area,
yes.
9,100 square feet, that's
Are you going to do real estate for me? I
Yeah.
like this.
handicap accessible,
Yes,
and it's
yes,
patient rooms.
yeah. I mean, would love to talk with you if you've got some thoughts on that, seriously. Thank you.
Okay.
I'm sure any space you find will need to be renovated.
Absolutely,
and
absolutely.
retrofitted
And
to-
there's,
to what
sometimes
we
there's
need.
funding for that type of thing. We did receive
Okay.
some when we did the Dunkirk. I mean, it wasn't huge,
did,
but we
yeah.
did receive some funding to assist with that, and there are still some grants available for that type of thing. So definitely, I would
Okay,
put the feelers out on that if that came
Yeah.
up.
get to work on that, Jane.
Yeah, there you go. I like this.
She's
and then-
writing stuff
Yeah.
down.
Wonderful. And I am here for the next item too, when you're ready. If
Oh,
you're-
okay.
Okay.
And then don't leave, because I can't.
Okay, no worries.
Okay, anything else on
Nope.
this? Okay. Number 9, proposed resolution to amend the 2023 budget to implement the Critical Incident Stress Management CISM team project using funding from the American Rescue Plan Act, ARPA.
Yes, that's what I'm excited to be here to present. So we did receive conditional approval by the ARPA committee, depending on these committees, to use $10,000 for on-site training. So CISM is a model that is not counseling, but it's peer support. It's designed to be used when there is a crisis, when there's an event that occurs that can have traumatic response, in this case, to our employees. So this is not for our clients. This is for the people taking care of your community.
Oh, nice.
So this is for our employees. So you think about, we've got several different leads in this room. You think about the health department, things that they face. You think about that, as I was listening to Dr. Falk talk, if we did have a mass shooting, you think about the impact of his team taking care of that volume of bodies. You take on a daily our CPS workers and imagine some of the things they walk into. You take our mobile crises team who may be there as somebody has fatally hurt themselves. Those are the kind of things that impact our teams. We have what's called certified peers, meaning that they have had lived experience and now they are certified to help others. And they're helping others, but they're hearing these stories all day long, every day. That reminds them of their own stories. So what CISM does, and I led this program at the hospital too, but what CISM does, it's training for specialized staff, and this would be a team of up to 20 to 25 people, and we'd be selecting that team, interviewing for that team, making sure those employees, and these are not all counselors, so it would be people from Dr. Falk's team, maybe a couple nurses who can relate to nurses. I'd be looking at Gib Taylor's team of probation workers who, let's face it, I walk in and talk to a probation worker and he's not going to feel the same thing as a peer talking to him. Okay? People from social services, folks from our department, really getting trained. So this covers the trainer coming, the international certified trainer coming to us, providing several days of on-site training all day long, and then follow-up for the certification so that our folks are trained when there is an event, there is an occurrence. Let's say it's a death of an infant, that somebody that CPS worker's been working with for 6 months, and that infant dies. The impact on that person, so being able to, and it's voluntary, it's not required, it's not mandated, it's not through HR, but HR may be a person who notifies us of an event to say, hey, reach out to the supervisor, see if they need your help. It may be a team. We've done this a couple times informally when there's been a need, when a case did not go well and it affected several staff on a team. A few of us who have had previous training went out and supported that team. So this would be a Chautauqua County team your employees within the Human Services Department who, for any reason, very confidential, could do debriefings one-to-one, could do debriefings for a group. And what it does is it provides support, it helps with resilience, helps with stamina. It's been known to help with job retention because it decreases burnout, decreases those things that result in call-ins. I mean, if I'm stressed and overwhelmed every day because of what I'm seeing, I'm more likely to call in, feel sick, be sick. It normalizes stress reactions because if all of a sudden you're seeing things and you're not sleeping for several days in a row, that actually is normal. But to normalize that and to say, here's when you get help, here's when you don't. So that's what CISM does. I'm a firm believer in it. I've seen this program work.
Are you trained in it?
I am trained in it
Okay.
from the hospital, but I'm not trained to be a trainer. So yes, I led the UPMC Chautauqua CISM team when I was there. And we would do things like go to the emergency department when there was a bad outcome. And we had an ED nurse who, there was nothing better than having her show up and talk with another nurse who felt like an ICU nurse who was tough and strong and thought she shouldn't be feeling things. Nothing better than a nurse to nurse. Nothing better than a doctor to doctor. So that's what we're proposing for Chautauqua County government. I've talked with County Executive Wendell about it when I first came in here. He's very supportive of that. I've talked one time with some of our directors in Human Services, and they're very supportive of it. So if it's approved, what we'd be doing then is talking with the directors, sending out information about it, and asking for applicants who wish to be part of the CISM team. Then a couple of us would be interviewing those folks and making sure they're asking for the right reason, making
Right.
sure it's appropriate, and then go from there, coordinate the training, and start providing CISM. And what I would suggest, since this is ARPA funding and I'm responsible to you, is I would love to come quarterly, 6 months, and just give an update report, so you know where this ARPA funding is going.
Sure.
Good.
I would expect you would want that from me, and I'm going to say I would provide that for you, okay?
How big would the team be?
The team could be up to 20 people.
Up to 20. You
Yeah.
might have said that. I
Yeah, so that's
apologize.
okay, that's okay, good
Is there
questions.
ongoing training or like, when we see
Refreshers
turnover?
annually, yes, refreshers annually, and then there's also team support and meetings, because that team also needs to make sure they're being taken care of. So part of that is meeting regularly, usually every couple weeks, to give that team support, see what's going on, see if there's certain themes that we can help even send out general education for, and then refreshers. The refreshers are usually they're not cost prohibitive. We're not talking that kind of money. We're talking several hundred. In addition, I'm hoping that within a year and a half, New York State Office of Mental Health is also looking at providing some county-specific training throughout New York State. So that may also support as we keep going. I've talked to them about what they're doing, what we're doing, and hope to be doing, and they're very supportive of seeing if we could continue it.
That's what I was going to ask. If this $10,000 is going towards a trainer from, I'm assuming, a private organization or,
Well, it's from the International
Okay.
Incident Management.
okay.
So it's a certified trainer.
Does the
yes.
state offer any type of?
State
similar-
does not with this, not with CISM. They offer smaller pieces, but not for a whole team. So in this case, what our recommendation is that we actually have this type of a team that can respond. What I've noticed since coming to the county is that we're diverse enough that the support, it's tough to feel interdepartmental support. It's different. Each department has it a little bit, but then to provide it for each other is tough. So if we could get some cross-training among departments and not have it just be a counselor thing, because the other piece is we don't want departments to think they're getting therapy. They're not. They don't need it. If they need therapy, we can make a referral. We want them to have resilience and support. That's the goal of this one, which is different than, and it's supposed to be peers rather than, because we have an EAP, that's different too.
That's what I wrote down.
Very good. Very good. We do have an EAP, but that's a professional counselor. So what we're talking is a peer-to-peer support,
Yeah.
peer-to-peer.
Is there a link between EAP and this? Like, for example,
Yes,
if someone
very
reaches out to
good.
EAP, is there an opportunity to contact?
Absolutely.
Okay.
The recommendation would be if there was again, my gosh, I was talking about this a couple times tonight, does not jinx anything, but if there was some kind of mass shooting, for example, what we would do, and we had a SISM team. We'd had SISM team. I'd also reach out to EAP. They would also come, and we would do dual. So folks who were suffering in a different way, that maybe they'd been through something before, it triggered something else, they'd be referred to EAP right away too. Yes.
So generally speaking, people
Okay.
ask us why we spend money, right? So can
Mhm.
you just, for the audience,
Yep.
just explain why this is not EAP and the I'll just let you go with that.
Absolutely. Peer support is a different model. So peer support is designed to be normalizing stress reactions, not looking at the whys behind it, dealing with debriefing, immediate debriefing within 24 hours, on site with somebody you trust and someone you can see each day. That's the difference.
Okay.
Honestly, I was an EAP counselor too, years ago. This, I gotta say, I'm a believer in, and I refer people to EAP, still to this day, to our EAP. It's different. And I refer people to therapy. It's different. Peer support is resilience, support, normalizing stress reactions, so to prevent the need for therapy. That's what often it does.
It's a first step.
It's the first step.
Yeah.
It's the first step.
That's a great
And-
explanation.
And usually,
Thank
and
you.
truly, 24 hours. If I hear about something, it would be, would you like us to come? We're glad to come. We can be there today if you'd like. What would you like? And then a small group would come, usually 2 people, to help debrief.
So I would say the accessibility is
Is-
extremely increased over an EAP program.
Extremely. And it's face-to-face. We're not talking tele.
Right.
So the 20 people, it would be like,
It's a team.
it's a team, but
Oh, they're not,
one individual.
Oh, yes.
Then the 2 people.
Yes.
Who are
yes.
specialized.
And,
or
and the
that
right
field.
fit. And the right fit. So there's
right, the
that
right
probation.
fit.
You know, me coming up to give staff is probably not the same thing as somebody who's been there.
Yeah,
Okay?
exactly.
It's that been there piece. There's a difference too.
Yeah.
Exactly.
Okay,
Been there,
that's
done
what the
that,
peer
yeah.
piece is. It's I've been there.
Yeah.
I know what it's like. Okay,
Yeah.
it works.
We
So,
appreciate your enthusiasm.
thank you.
Yeah.
Thanks. And
Very
so thank
nice.
you for that.
Thank you.
And I have an idea before you leave. Okay.
Okay, that's it for the resolutions. Is there any other that we need to talk about? Yep. Oh, okay.
Just when you thought you'd get out early.
No, I gotta be here till 7, so
Just
you
when
could
I
talk
thought
all
I
day.
was gonna get out here to go to another meeting somewhere else.
All right. Dr. Mike Falk, Interim Public Health Director and Chief Medical Officer. I am making the rounds to admin services, human services, and audit control to share some very good news, which you may have caught wind about already.
I watched the administration.
But I'm gonna,
You can tell us anyway.
I'm gonna tell you all over again. There's new people in the room. But anyway, as you know, for the last year, in addition to my duties as county physician and chief medical officer, I've had the honor and the privilege of filling the role of public health director, interim public health director, with a focus on the interim part. The interim role was really meant to be temporary, to get us kind of through the transition to a standalone health department. Both myself as chief medical officer and County Executive Wendell, we are pleased to announce the appointment of Lacey Wilson as the next public health director. Lacey was raised in Chautauqua County and is currently serving as Deputy Public Health Director for our Chautauqua County Health Department and is a registered dietitian nutritionist with a master's degree in public health. Lacey earned her bachelor's degree in behavioral psychology with honors from Allegheny College in 2007, a master's in public health with honors from the University of Albany in 2011, and a dietetic internship at Sage Graduate School in 2013. Lacey has more than 10 years of experience in community health, social behavior, aging services, public health program planning, development, and implementation. She is particularly skilled at analyzing systems within programs and redeveloping processes to improve efficiencies in innovative ways. She has provided sports nutrition and wellness consulting to more than 50 athletes as an American Council of Exercise certified personal trainer. Part of this work included oversight of nutrition and food services for the 2012 New York Giants summer training camp.
Ugh.
But as I joked the other night, Lacey is a proclaimed member of the Bills Mafia, so fear not. She is, yes.
Just want to make sure you say
That's right. That's right. Could have been a deal breaker, right? You never know. 2017 to 2019, she was the Seneca Nations of Indians Nutrition Director, where she redeveloped nutrition programming infrastructure to reduce overspending and improve service delivery, adherence to compliance standards, and food safety. 2019 to 2023, Lacey served as the coordinator of nutrition and wellness for our Chautauqua County Office for Aging Services, where she developed, managed, and monitored county-wide food services, as well as provided nutrition counseling, education, and wellness programming for more than 1,000 clients. Since her arrival at the Health Department as Deputy Public Health Director, Lacey has quickly established great rapport with not only our Health Department staff and division leaders, but also with other county leaders, department heads, and community partners. She has already established herself as a strong leader and brings a unique perspective when evaluating the current framework of the Health Department. It should be important to note that we, at this time, have no plans to backfill the Deputy Public Health Director position. We feel as though we have a strong leadership structure with Lacey's experience in public health and community health and programming, in my clinical experience as a physician with almost 20 years of experience in emergency medicine. Lacey will take on the day-to-day oversight of the health department with the full authority of the public health director, while I continue in my role as county physician and chief medical officer, with a shift in focus more towards jail medical services, the coroner's program, the county's emergency medical services, and supporting our county special teams with medical support. But we'll continue to provide daily and continued leadership support for our health department. So that is the
Great.
good news.
it is good news.
Any
Thank you.
questions?
Yep.
Good.
No.
Thank you.
Thank you.
Appreciate your time.
Any other? I guess we don't need a motion to adjourn because we aren't really,
We never really met.
never really. Isn't it? Oh. We sign these things?
We signed them, right? Okay, there's the agenda.